Welcome to the Functional Medicine Foundation's podcast, where we explore root cause medicine, engage in conversation with functional and integrative medicine experts, and build community with like-minded health seekers. I'm your host, Amber Warren. Let's dig deeper. Welcome back, everybody, to our podcast. I'm here tonight with Dr. David Musnick, back at our Eagle location to have a really good discussion on functional immunology and frequency-specific microcurrent. So Dr. David Musnick is a highly accomplished clinician and diagnostician specializing in orthopedic sports medicine and functional medicine. With board certifications in both sports medicine and internal medicine, he brings an impressive 33-year background in sports medicine and internal medicine and 26 years in functional medicine. Dr. Musnick's extensive experience has led to the development of his unique assessment and treatment approach, showcased through countless cases. Not only has his work been published in numerous books, he's also a sought-after speaker on various conditions, notably arthritis and concussions. Originating from Boston and spending much of his career in Seattle, Dr. Musnick now calls Idaho his home, bringing his expertise and passion for athletics, outdoor activities, and specialized treatments in the community. And we are so grateful. How are you this evening?
Good. You want to hear something funny?
Always.
So the 33 years is now 35 years.
We have to update that.
Because I've been here for 2 years.
I can't believe you've been in Idaho for 2 years.
Yes.
Star is actually his local
Star is
home.
my home.
He takes great pride in that.
Yes.
So we're going to spend some time tonight talking about a couple different things, but I wanted to start with just your area of expertise within functional immunology, because I think it's really important. Obviously, you and I both know, as of late, autoimmune diseases continue to be on the climb and on the rise, and we're seeing more and more of these patients in our clinic. Oh. So what is functional immunology?
So functional immunology is an approach to immunology. So first of all, immunology is the study of the immune system. Mm-hmm. But functional immunology is the study of the interrelationships of the parts of the immune system and what will affect the different parts, and is a very sophisticated set of information about this, because there is so much information about what affects parts of the immune system. And the immune system is a very dynamic, important system. It's our defense system. Mm-hmm. And we're now seeing like literally an epidemic of all kinds of problems with the immune system. Yeah. Because autoimmune disease is a big problem with the immune system, and it's on the rise. And
why do you think that is? Why do you think it's on the rise?
That's a good question. Mm-hmm. First of all, I want to define what it means.
We'll start there.
So an autoimmune condition would be something like rheumatoid arthritis, but what a lot of people don't realize is that there's many different autoimmune conditions that have been characterized, like lupus. But they also don't realize that multiple sclerosis is an autoimmune condition. Right. So we can have autoimmune conditions of the nervous system like MS, and then we can have autoimmune conditions that aren't necessarily just simply the immune system. So some autoimmune conditions are targeted towards very specific tissues, and some of them are much broader, like lupus is much broader in terms of the immune system, targeting many different tissues. Right. And so what this is where a person's own immune system mounts an immune attack really on certain tissues, causing a tremendous amount of inflammation and tissue damage. And it's a dysregulation of the immune system, because our immune system should be able to realize, okay, this is my cells, this is my tissue, this is my myelin, this is synovial tissue in rheumatoid arthritis. And what happens is the immune system gets dysfunctional and dysregulated and doesn't recognize these tissues as self, and then mounts immune reactions, which are usually very destructive and damaging, causing a lot of inflammation, but also tissue damage. And a lot of people don't realize that, like Hashimoto's thyroiditis is primarily an autoimmune condition. The other thing a lot of people don't realize is that a lot of people, and I've found this with patients, they think you get a diagnosis of an autoimmune condition and that's all you're ever going to get, that one. It's like, my motto is like, you have got to prevent further autoimmune conditions. I saw a patient here with 4 autoimmune conditions, and they were all pretty severe. But the rheumatologist that saw her never talked about prevention of more autoimmune conditions. And so it's a dysregulation of autoimmune conditions, dysregulation of the immune system in terms of the immune system going after self-tissue. It depends on genetics. It depends on why it's going on. And we could talk about why it's going on. And there seems to be a marked increase in it. And we can also talk about an interesting topic in functional immunology, like, well, you go to the rheumatologist and they use the biologics.
Right.
What's the difference between that and functional immunology?
Yeah,
and if you want to talk about that, that's a huge topic.
I think we should. So let's start with my first question. Why do you think we're seeing this rise in autoimmunity?
So there's a lot of different theories. And I remember I was really impressed. There was the Institute of Functional Medicine's annual meeting in 2017 was on autoimmune diseases. And some of the biggest known researchers in the world were there. And so one of the theories is that we have so many chemicals that we're being exposed to and toxins that when they're in our tissues, our immune system may not be able to recognize that this tissue, like the lining of the small intestine or a piece of thyroid tissue or myelin, is actually self.
Yeah.
Because there's chemicals in there, metals, pesticides, herbicides, toxins, and it makes the immune system literally confused.
I've described it, I 100% agree with you, and I've described it to my patients before as kind of like a conveyor belt, and there's, different things coming down, like, oh, we know what to do with that, we know what to do with this. There's that component, that antigen, right? But then all of a sudden it starts to get overwhelmed, and it's kind of like there's, you've seen funny commercials where products start flying off the conveyor belt, right? And it's like your immune system's like, oh my gosh, gluten and glyphosate and BPAs, and I don't know what to do with all these things. So it does just start to get really confused and just attacking everything, because that's its job, is to protect us, right?
Yeah. So I mean, you brought up some good points there, and so one of the theories that I agree with, and I think is very important, is this toxin theory, confusing the immune system. And the average person could think of this as there's too many toxins that are stored in their tissues that they haven't detoxified, because these toxins, they're in our tissues. Right. They're in our muscles. They're everywhere. And, even the CDC has done studies where they take fat biopsies from the average person's abdomen, and they've done it with like 100 people, and these people weren't even industry workers, and the average person had at least 35 highly toxic chemicals, if not 50, in their fat samples. And they allotted like $15,000 per person to test all these things. Right. And this has been repeated a number of times. They did this actually in the state of Washington with 35 people. So interesting. But there's other theories. So I think there's multiple factors. It's not just one. So another factor, I think, I really do think that intestinal permeability or leaky gut is a factor, because if the intestine is supposed to have these tight junctions and only let certain things through and not let other things through, like, small food particles that have been digested and other things, but not let parts of bacteria through, called LPS, and not let big molecules through. And then I'm seeing really a very significant rise of intestinal permeability and leaky gut with antibody testing to things like zonulin and actin and LPS in a lot of patients that have autoimmune conditions or gut conditions. And I'm convinced a lot of it is from, glyphosate and other insults to the gut. But I do think that intestinal permeability is a gateway, because then what a lot of people don't realize is on the other side of the intestinal lining are these cells called dendritic cells. And they're kind of like the cops, and they're like sitting there, it's like, if there are dendritic cells in Eagle, they'd be at State Street and Eagle Road. And they're looking, is anything not right here? And they're surveying all the time. Well, if they start seeing really huge molecules from food that is not being broken down, or parts of bacteria, or even, chemicals, pesticides, herbicides, they're going to sound the alarm and say, I don't think this is self, and that's going to start an immune response. Then there's something called molecular mimicry, which is where the immune system gets confused with parts of bacteria that might be in there, because we still have some bacteria in the small intestine. We have a lot in the large intestine. But the immune system is supposed to go after bacteria, but if it goes after, amino acid sequences and the same sequences are in our tissues, that's called molecular mimicry. So there is actually a role for microbiome testing in people with autoimmune conditions.
So is that where you start with functional microbiome testing?
It depends on what the case is and what the person is, because I think, and initially, like with someone that has an autoimmune condition, it's better to gather as much information as you can. So I usually start with an intestinal permeability test.
Good.
Then I sort of do an assessment of, toxin exposure. Part of the problem is that I've done enough of these total tox burdens I see so much of it that I'm almost assuming that people have so much of it.
I know.
So if I'm trying to save people money with diagnostic testing, I'm going to get a leaky gut test. I'm going to get a stool analysis because I want to know, do they have a parasite? Because there's a theory that parasites can even trigger this through allergic mechanisms.
Are you finding that testing pretty accurate? I just don't find stool testing very accurate for parasites.
There's a lab, Genova, that has correlated certain bacterial strains with certain autoimmune conditions.
Okay.
So I like to get the whole test, not just part of the test. I want to get the whole test. I want to know what the strains are.
Yeah.
Sometimes I'll order a food allergy panel because it appears that the total burden of allergic mechanism in that person, and this gets into what is functional immunology. So let's just say a person says, I'm allergic to a lot of foods. And why am I allergic to a lot of foods? And you find out, they do have immune responses on a test, like 25 foods. And you say, okay, something is really wrong with your immune system. You shouldn't be allergic to so many foods. And they say, I can only eat a certain number of foods. Then what that does is it means, in some respect, that certain parts of the immune system are out of balance. And so you can get at the same time something called the Th2 system upregulated because of so many allergies. And the Th1 system that's supposed to defend against viruses will go down. It's like a seesaw.
Yeah.
And then the Th17 system that does relate to immune tolerance and autoimmunity, and then something called the Treg cells will go out of balance. So part of what functional immunology is evaluating these cell populations and seeing what you need to do to get them back into balance. Because that brings up a really interesting point of, if I'm evaluating a person with an autoimmune disease, lupus, rheumatoid arthritis, MS, whatever it is, one of the biggest goals is to decrease triggering an autoimmune flare. So what most people don't understand is that these things go almost like they get triggered, they get worse for weeks and weeks, and then they calm down and they get triggered. So what we're trying to do also is decrease the triggering of the autoimmune flare. That will decrease tissue destruction. Because I've had some patients say, hey, can you totally reverse this? And this has been a debate in functional immunology for a while. And the issue is you may not, and you likely cannot totally reverse the tendency towards autoimmunity, because the body has memory T cells that are going to remember this tissue and go after it if something triggers it. But you can greatly decrease the triggers, and you can make it so that person has very few autoimmune flares and is not continually suffering from tissue destruction, and also is less likely to develop another autoimmune condition.
Could we spend a little time talking about Hashimoto's? One of the most common autoimmune diseases. Where do you think that root cause lies with that?
Well, it probably is one of the most common autoimmune conditions. And, one of the things that's said, and I think this bears out, is I think that a very high percentage have a problem, either gluten sensitivity or celiac, but more probably gluten sensitivity. I think there's some mimicry going on with this. And I do think that that it's indicated to take people off of gluten completely, to check for leaky gut, to check for other food allergies. And, some forms of hyperthyroid are also autoimmune.
Graves' disease.
But it's much more common to be the hypothyroid type.
Do you find yourself putting these patients on thyroid replacement to get them euthyroid or to treat the hypothyroid state? Do you find it helps the Hashimoto's part?
So I think so here's the interesting thing. The non-functional medicine, non-functional immune approach to Hashimoto's, if you go to an endocrinologist, is either to do nothing or to put the person on thyroid hormones if they're have a low thyroid situation. I think you do have to make the person euthyroid. I think that's very important, but you have to go after all the possible triggering mechanisms. And there's triggering mechanisms and there's self-perpetuating mechanisms. And I do think there's a toxin issue with that one too.
What's difficult about our conventional system is there's a lot of conventional practitioners or even endocrinologists that aren't even looking at the thyroid antibodies, and that's how you diagnose Hashimoto's. So they're just chasing maybe even just the TSH. They might not even be looking at the T3 levels, or T4. And so a lot of times we're just increasing the dose, and really not looking at root cause and not even seeing if that patient carries that diagnosis. Because Hashimoto's is what's driving the hypothyroidism. So if you can't get the patient to be euthyroid and get them feeling better, if you don't know what's causing it.
Yeah, and you also brought up a really good point, which is monitoring antibodies. So one way you can tell if the person's immune system is improving is monitoring antibodies.
How often, so I'm so glad you brought this up too. How often do you monitor their antibodies with the treatment protocol plan that you've laid out for them? Because they take a long time to respond.
They do.
Agree?
Antibodies don't shift quickly because antibodies can stay up for a while. So I think, say you do, say I start seeing a patient and then I start some pretty significant interventions. And I want to see, okay, how are these interventions working? Besides the fact that, we might have them fill out an MSQ, which is a medical symptom questionnaire, like how is it working in terms of also the antibodies? And so I think, you can check them. So you start interventions, and if someone's going to do these interventions, because I usually say, if you do the intervention for 3 months, then in 4 months, we're going to check the antibodies.
Okay. So I usually wait 6 months, and maybe I'm waiting a little bit too long to repeat these antibodies.
Not necessarily. I mean, I think 4 to 6 months is reasonable.
Yeah. Okay. That's interesting. What are some of your favorite autoimmune conditions to treat?
I love treating MS.
I knew you were going to say that. Why is that? Well, it's because you're really good at neurological conditions. That's why.
First of all, MS has a lot of physical findings. MS really affects people. So MS is an autoimmune condition of myelin sheaths. It's very specific. And you can actually measure, there's actually a lab called Vibrant Labs that measures antibodies to myelin. So you can measure those antibodies over time. But one of the things I really like about MS, because the way people know that they have MS, besides they're having coordination problems or pain or spasm or nerve pain, is they'll have an MRI of their neck and or their brain, and they will show these lesions. And these lesions on MRI are very inflammatory. And so the biggest thing that's going on with this is not only are they losing myelin, but they have these areas of inflammation and edema that are impinging the ability of their spinal cord to work and their brain to work. And so I like to integrate functional immunology with frequency-specific microcurrent. And then I'll use the frequency-specific microcurrent, abbreviated FSM, to decrease the inflammation in the lesions and shrink them.
That's amazing.
And that's exciting.
Can you break down how frequency-specific microcurrent, we do a lot of it here at our Eagle Outpost, as you like to call it. So break down, how does that work? What is it, and what's the mechanism behind how it works?
So it's called frequency-specific. I still want to talk about some more functional immunology.
Sorry, I know. We can go back to that, but I want you to as well.
I get very excited about frequency-specific. It's called frequency-specific because because it is specific frequencies. In frequency-specific microcurrent, there are two channels, channel 1, channel 2. Channel 1 is the condition channel. Like there is an inflammation frequency, 40. So there's a lot of different conditions that we can treat, like 9 is for allergy.
Right.
So I will use that for I will use FSM for autoimmune conditions and often improve the specific tissues or run it over the thyroid or whatever it is. So channel 2 is the tissue channel. So channel 2 could be myelin. Channel 2 could be the nerve, like 396. Channel 2 could be the spinal cord. So for instance, just for instance, I'll run in a person with MS that has spinal cord lesions, 40 on channel 1 and 10 on channel 2 to decrease inflammation in the spinal cord, but I'll also run 9 and some other called condition frequencies, because I've designed a lot of programs for MS and other things, many other autoimmune conditions and all kinds of conditions. But it's nice because in general, FSM, it's very comfortable. It's very relaxing. There's almost never any side effects. I mean, sometimes people get a little sleepy or rarely and a little dizzy, but that's uncommon. So the person's experience of getting an FSM treatment is, wow, I get to lie on this really comfortable table and it's relaxing. They could listen to music. I don't let them stay on their phone or get exposed to EMF because I don't want a lot of EMF while they're doing it. But so what's really interesting also is there's been studies on the biological mechanisms of FSM. It turns out the 40 frequency decreases almost all inflammatory cytokines in the tissue. The other thing it turns out that the frequency, just almost any frequencies do, is increase ATP. They've discovered in tissues almost a 5-fold increase in ATP. And then there's something called cell signaling that gets improved. So what happens is in diseases and in tissues that aren't doing well, cells are trying to communicate with each other and signal. And we don't talk about this a lot, but it improves cell signaling.
That's wonderful.
Those are the biological mechanisms of it.
Yeah.
I've treated so many conditions with it that I can tell you successes with all kinds of things that it can do, but those are the biological
You
mechanisms.
treated my knees with it, and it got me to go on a ski trip, and I didn't have any knee pain on my ski trip, and I was struggling. So
That's good.
I can speak to that, my own testimony.
Yeah.
Are you tired of cookie-cutter health that doesn't address your unique needs? It's time to discover functional medicine care designed to help you flourish. At FMI, you'll gain access to a range of benefits tailored to support optimal health and longevity. Experience the power of personalized care and take control of your health with an annual membership at FMI Center for Optimal Health. Visit www.fmioptimal.com/membership today and start thriving.
Let's talk about, I know you wanted to return to functional immunology. MCAS, can we talk about mast cell activation syndrome? Because I think that's a big one, and I think that's one that people walk around undiagnosed, not knowing what's wrong with them, because practitioners don't know how to diagnose it. They don't know how to recognize it. It's just not talked about enough. So what is mast cell activation syndrome, and what are mast cells?
So mast cells are part of the immune system, and they are part of the defense system. So they're designed to take care of organisms that shouldn't be there, like bacteria and viruses. And they also they're very reactive in allergic situations. Mast cells produce a lot of things. They have their granules, and in the granules are the things they produce. The thing they're most well known for is histamine. But they also produce other things, bradykinin and a lot of other things, actually. So if someone's having a mast cell, if a lot of mast cells are reactive, so this gets really interesting, because did you know that mast cells almost have nerve endings near them?
Wow, I didn't know that.
In the interstitial tissues. So there's a nervous system issue involved with this. That's why stress could trigger a reaction or something. So years ago, nobody was talking about mast cell activation syndrome. I remember when I was in medical school, I thought I had a mast cell disease. You know, when you're in PA school or medicine, you say, oh my God, do I have this disease, right? Oh, here's another one added to the list. Because I had dermatographia, which means if you took your fingernail and wrote on my back, because I used to be very athletic and would swim and whatever, and one time someone, how come when I write my name on your back, you can see it for like 20 minutes?
Why were people writing their names on your back?
Just one time. It was during med school.
Oh, okay.
Because
they were trying to be funny?
No, it was a lab. They told us to do this. We were studying
okay. That makes so much more sense.
We were studying the immune system.
Okay.
We all had, we had to all do this. Anyway, I
thought you were part of like a really strange fraternity or something.
Okay. So if you get this red reaction, that's not unusual. But if it stays around a while, it is. It's called dermatographism. And there is a mast cell disease that actually leads to cancer. So, of course, I thought I had that, but then I realized, I probably didn't. But I knew about mast cells a long time ago, thinking about that. But I've been following this field for a long time. So I would say that in order to have mast cell activation syndrome, you have to have mast cell-related symptoms. And why this is important is I had a patient recently, I'm not going to say who she was, came in and thought all her conditions were related to MCAS because some other provider said that's what it was. She had almost no symptoms related to histamine or bradykinin or anything like that. Like runny eyes, runny nose, excessive mucus, hives, dermatitis, any of the things usually associated with allergy. Because usually, in order to say someone's got mast cell activation syndrome, people are going to be, having those things. But there's also GI symptoms associated with it.
And headaches.
So there can be all kinds of things associated with it. And so I think the best way to approach it, first of all, determine, is this all that's going on? Because I found almost every time someone has this, it's not the only thing going on. They have some other condition too, or they have mold biotoxins. They have something that started it or something that's perpetuating it.
It's not necessarily root cause medicine. It's a diagnosis we can treat.
Right.
We want to find out what's triggering the mast cells to go haywire.
Right. And so, there's so many approaches to it, like low histamine diets, but I also think you got to get to the root of it. And I've also incorporated frequency-specific microcurrent and design programs to treat the mast cells.
Oh, good. Yeah.
Because the other thing you have to treat with this is the autonomic nervous system.
Right.
Because it has some control over mast cells.
Yeah, interesting. Do you see long haulers COVID creating mast cell activation syndrome, or even an acute onset of COVID that's not long haulers? What's the relationship there?
Well, if someone already had mast cell activation and it was a bit quiet because of whatever we were doing, and then they got COVID, it can trigger to make it a lot worse. And there are people definitely with long haul COVID that have long haul COVID and mast cell activation syndrome.
Yeah.
And so you can, the problem is now it's like people were complicated enough before COVID.
Right.
And now you got to consider, okay, are these, because some people have headaches and brain fog and many, many, many different symptoms, fatigue. Even if you just take that, headaches, brain fog, and fatigue, and say, what could it be due to? There's a number of things that could be due to besides mast cell activation syndrome.
And I think we get in trouble too, in medicine in general, but functional medicine, when we think we're going to find one thing that's causing the issue, right?
Right.
A lot of people, mold and Lyme go hand in hand. For a lot of people, it's toxicities and mold's included in that, or it's stress, trauma, and mold.
Right.
So I think it's that TAC theory, right, that we learned early on in our functional medicine training. If someone's sitting on 5 TACs, if you pull out one, they don't feel better.
Right.
You have to find all 5 tasks.
Find all the TACs.
Yeah, and I think that's where your approach, where you're starting with the gut and then kind of casting a wide net, is really wise, especially when it comes to these autoimmune issues.
Well, I find these days also, you've got to look at, okay, what possible reactivated viruses they might have.
Yeah, reactivated Epstein-Barr. Yeah,
because that's very common with long haulers COVID. And could they have mold biotoxins? Because that's very common. And then could they have Lyme or co-infections? Those kind of things. A lot of people have a number of these things mixed together. And then you have to have a very strategic approach to this. Because if you miss one of these things, you're missing a big deal.
So are you looking at just serum labs, just blood work to look for these reactivated viruses? How are you?
Yes.
Okay.
So in functional immunology, one of the rules of thumb, say, is if the level of certain antibodies is six or more times higher than, quote, the lab's normal, then the virus is reactivated.
Okay.
And there's always certain things to look at with each virus, like something called ABNA with Epstein-Barr is usually like, especially if you see something like greater than 600. I've been seeing that a lot lately. And then you know it's reactivated.
Right. Okay. And how are you treating those patients?
So I do want to explain what reactivated means.
Oh, that's a good point.
Because that's really important.
Yeah.
And this relates to functional immunology. So almost all of us, say, just for instance, have Epstein-Barr in our bodies. And the immune system is supposed to contain it. And it's supposed to be like, okay, you have a party and Epstein-Barr is invited because they're invited to all your parties because they're there if you've been exposed to it with mono or whatever. A lot of them have been exposed to it. And you just want the Epstein-Barr to eat some chips and not destroy the furniture and not multiply and not scream and yell and have a tantrum. You just like, okay, just you stay over there and just stay calm because you actually don't want it multiplying and you don't want it doing damage. And so reactivated virus, whether it's reactivated Epstein-Barr, I'm now seeing CMV, something called CMV. I'm seeing all kinds of herpes viruses reactivated. And a lot of people don't realize that herpes zoster or zoster is actually reactivated chickenpox virus. So it's the immune system becoming dysfunctional and not being able to stop replication of a certain virus. And I would say I'm not going to state everything that I do for reactivated Epstein-Barr because I've got some incredible protocols for it. So for instance, I'll just mention one thing. I do use homeopathy in my practice. I like it because it's very low. The homeopathy remedies themselves usually are low cost, but there are homeopathic methods to treat reactivated Epstein-Barr. So I usually use a combination of homeopathic methods and certain herbals to treat it.
And I imagine you're working on the immune system, gut health.
Yeah, but the other thing that I think is very interesting in terms of functional immunology is you can get some lab tests to assess natural killer cells. I've been finding a lot of people that have low white counts. And often if they have a low white count, it's indicative that their white count is not high enough to be able to protect them against viruses. And so then...
Why is their white blood count low?
Well, I want to finish this one thing.
Okay, go ahead.
So...
Because I'm seeing that a lot, so I want to touch on that.
So what's interesting is it seems like a lot of people, and this is a common pattern I'm seeing, and a lot of people in functional immunology know about this pattern. These part of the immune system that's supposed to defend against viruses has gone down in numbers or is weaker than other parts of the immune system. It's like out of balance. And so one way of then dealing with viruses is to improve the Th1 and natural killer cell part to be able to counteract viruses. And we even have a product here.
I was going to say we have great products.
We have great products that we use for functional immunology here. These three products that we have here, especially, were developed by this doctor that's like the founder of functional immunology. One of them is called innate immune support.
It's a great product.
In terms of why the immune system, why white cells can go down, that's a really good question. That's called neutropenia. And in general, I like to see more than 5,000 of those white cells.
But it's mind-boggling how many people are well below that.
I'm seeing a lot of people below 3.5.
Me too. Yep.
So I think a lot of this is bone marrow suppression. I think there's certain toxins that are doing it, but viruses can definitely do it.
Yeah.
I've seen it with Epstein-Barr. I've seen it with chronic viruses. I've even seen it with Lyme. So I think in order to assess that, we have to say, okay, is this the only thing that's low?
Right.
Because oftentimes I'm seeing a normal hematocrit, normal platelets. It's the only thing that's low.
Yeah, agreed.
So then you say, okay, the immune system is out of balance. Then I want to measure natural killer cells. I want to get a panel like that. There actually is a panel. There is a lab that will measure your whole immune system. Cyrix Lab has an amazing panel to do that, where you can see it. But I think that you can't always tell exactly, okay, is this heavy metals? Is this viruses? Is this toxins? Is it glyphosate? But it's probably one of those that is suppressing the bone marrow.
Stress, do you think the stress can drive the neutropenia?
Yes, it can.
Yeah. Okay.
And that's really an interesting thought, because stress really can adversely affect the immune system.
Right. Oh, I know.
It's one of the triggers.
Yeah. We don't want to miss that one.
Yeah. But you know what else can adversely affect the immune system? Its ability to fight viruses? Less than 7 hours of sleep.
I was actually just going to say that, sleep deprivation.
Yeah.
It's such a physiological stressor to the
It
body.
affects the immune system.
Yeah. And it drives up inflammation like overnight, within a few hours.
It does.
It's pretty wild. Are you using frequency-specific microcurrent specifically for this like molecular mimicry topic? Does it help that specifically?
Well, for molecular mimicry, I would use frequency-specific microcurrent, say in an autoimmune condition, to treat the tissue.
Like the inflammation and the cytokines.
Right.
Yeah.
But I often use frequency-specific microcurrent to get at causes. Like, believe it or not, there are frequencies for mold. There are frequencies for toxins. There are all kinds of conditioned frequencies, and then you can use that, say, with the tissue.
Are there frequencies for reactivation of viruses?
Yes, there's viral. There's actual.
Cool.
There's a number of viral frequencies that you can use.
Cool.
Well, so one thing that I think is fascinating is the vagus nerve controls a lot of things. From the heart down to the gut.
Yes.
And there's something called retrograde transmission of viruses, where a person can be exposed to viruses that then go from retrograde up the vagus nerve, even into the brain. And so there's frequencies for viruses that I've designed in programs for the vagus nerve to help the vagus nerve get healthier. Because we can do exercises like high intensity gargling and singing at the top of your lungs, but sometimes they do need that added treatment of say FSM for the vagus nerve, for viruses and for mold and whatever we think is going on.
Yeah. Vagus nerve dysfunction. That's what we could do a whole podcast on, just that topic.
But you know what's one of the most fascinating things with FSM?
What's that?
Is being able to take a patient with an enlarged fatty liver and get their liver back to a normal size.
Yeah, that is amazing.
That's I've done that numerous times with it. I usually combine it with phosphatidylcholine injections and such, and milk this and whatever to protect the liver. But the FSM is the thing.
It's so cool.
Because you can treat the fat in the liver, you can treat the fibrosis in the liver, and literally within 2 months, a liver that was like halfway down in the abdomen to where it's supposed to be.
Oh, that's incredible.
Yeah.
The work you're doing is so important.
I used to like liver when I was a kid. Now I don't really like to eat it, but I like to treat it.
We should eat it. It is such a super food. But there are really good quality capsules that we can take now. So you don't necessarily have to eat it. I try and sneak it in. I'll sneak it into like spaghetti sauce or taco meat. My husband grew up eating liver because his family was really poor. But so he'll walk in the house and be like, I know what you did. And I'm like, don't you dare tell the kids, because they don't know. They can't tell when it's.
When I was a kid, I knew it was liver, but I didn't know what it was.
Oh, yeah.
It's called chopped liver. I didn't know what it was. And it tastes, my mother made it so good, I just like didn't argue about it. The only thing I argued about is when they made this thing called tongue.
Oh,
and I was like, then I knew it was a tongue. I was like, I'm not eating that.
I'm not sure. Tongue, heart, I haven't gone there yet. But the liver, that's definitely something I've been trying to embrace more of. Yeah.
Yeah.
Well, thank you so much for your expertise and your knowledge, Dr. Musnick. It's always such a pleasure to pick your brain.
You're welcome.
Thank you for your time.
You're welcome.
Thanks, everyone. Thank you for listening to the Functional Medicine Foundation's podcast. For more information on topics covered today, specialties available at the FMI Center for Optimal Health, and the highest quality of supplements and more, go to funmedfoundations.com.